Just a thought. Hey, everybody. Good morning. Dr. Rafich here, September 21st, Saturday, 8:33 a.m. Pacific time. Let's talk about coughing. So coughing is very common in dogs and cats, and actually could probably think of dogs and cats as being very similar in a broad sense, but not more specifically than that. And so let's talk about the broad causes of coughing and the different scenarios. Coughing can be divided into two different categories. Oh, YouTube just restarted, so hopefully that all got recorded. So coughing comes in two different categories. The first is cardiac causes, so heart related or cardiovascular related diseases. The second is pulmonary or lung, or really anything airway. And so we try to differentiate, broadly speaking, coughing into those two categories: pulmonary or cardiovascular or cardiac. And so within those two big categories, we have a bunch of different causes. So for example, in relation to dogs, cardiac disease that are causing coughing most often is due to enlargement of the heart, also known as cardiomegaly. And there are a variety of different cardiac diseases that can cause cardiomegaly, anything from valvular problems to chamber problems to muscular problems. It doesn't matter really. It's more of any heart disease that causes enlargement of the heart can do it. And so that's a very common scenario, and in cats too, by the way, as well. Now you can have the other category of pulmonary disease, where it's things like pneumonia, bronchitis, kennel cough, etc. And cats have their own set of diseases, and they can get pneumonia too, but more often bronchitis or asthma. Of course, lung tumors as well, so cancer in the lungs for dogs and cats. Anyway, any broad category or any of a number of pulmonary conditions can cause coughing in dogs and cats. And there's an overlap. You could have both things, right? You could have cardiac disease like congestive heart failure that is causing fluid buildup in the lungs, pulmonary edema, and now you have both categories causing the cough in your pet, both cardiac and pulmonary. So there's a variety of different causes within those two broad categories, and then there's plenty of overlap there. The reason why veterinarians get a bit flustered, let's say, with a dog or a cat that's coming in for coughing is that because of that overlap, it's difficult to say for sure in some cases whether or not it's purely cardiac or pulmonary, or whether it's both. The diagnostics that you have to perform for such cases, for example, blood work and chest x-rays, can be a bit tricky to interpret, especially chest x-rays. In fact, the most common reason why I refer to a radiologist when I collect thoracic radiographs, chest x-rays, is because the patient is coughing and I can't figure out with 100% certainty on the radiographs whether or not it's pulmonary or cardiovascular. The other problem that vets have with these two broad categories is sometimes these pets are coming in with not just coughing, but they're having true breathing issues. They have true breathing issues that any manipulation, any stress that you place upon them will make the coughing or breathing worse, which makes them a bit unstable for doing things like chest x-rays, which are the main diagnostic tool that we use to differentiate different causes of coughing. So if you can't collect the x-rays, at the risk of making the patient worse or even killing them because of the stress of getting those x-rays, then you're stuck with, which one is it? Or is it both? Cardiovascular, pulmonary, or is it both? So, and then of course, if you do happen to collect radiographs in that kind of patient, you may still have the same issue of interpreting those radiographs, especially if the patient is in a compromised state. It may be hard on x-rays to tell between cardiovascular and pulmonary. So it's a common condition, coughing in animals. You have those two broad categories that can also overlap, and you have the added stress of difficult interpretation of diagnostics, plus the possibility of not even being able to collect diagnostics because the patient is too unstable, which makes it difficult for the veterinarian and frustrating for the pet owner. So a lot of the literature focuses on minimally invasive tools to diagnose cardiac and pulmonary conditions. There's been a lot of talk over many years of biomarkers, which are blood panels, specific blood measurements that look at hormones or chemicals in the body that may be increased, decreased, whatever, when you're faced with cardiac or pulmonary. Because you can imagine if blood work collection is less stressful than collecting x-rays in the PET, and that blood work can also tell you between the difference of cardiac versus pulmonary, that's a great test to have, right? But the issue is these blood panels, these biomarkers, are also subject to interpretation. They're not 100% accurate on both ends of things, both ends being cardiac versus pulmonary. A lot of veterinarians often misuse them or overinterpret them. So just like any other thing in medicine, they're not the one all be all of diagnostics for coughing pets. But it's a move in the right direction where we're trying to find less invasive diagnostics for these pets to try and diagnose them without adding more stress to them. And then, of course, as anybody would probably deduce, the treatment options for both categories are very different. You wouldn't treat a patient with cardiac disease with antibiotics, and you wouldn't treat a dog with pneumonia with blood pressure medications, right? And so two very different categories with two very different treatment options. And of course, if there's overlap, then you may be using more than one treatment option, right? But that also adds to the complexity of this, which is why it's hard for your veterinarian just to treat blindly without first running the diagnostics, assuming the diagnostics won't make the patient worse. So in this scenario where the veterinarian has to guess because they don't have access to diagnostics and the pet is too unstable, they end up treating for what's most likely. And sometimes they do treat for both things. For example, and this is for the veterinarians who watch us in the playback, if, for example, the veterinarian is trying to figure out based on examination findings, what's more likely, cardiovascular versus pulmonary, well, there are some tricks to that. For example, most pets that have cardiac disease also have a low body temperature because circulation is poor. Whereas most pets that have pulmonary disease like bronchitis or asthma or pneumonia have a fever. So they have a high temperature, for example. Not always, these are not clear cut, but for example. Secondly, there are characteristic age and breeds that get cardiac disease. Most cardiac disease happens in the older pets. A lot of Pomeranians, Chihuahuas, Maltese, Shih Tzus that'll get these cardiac diseases. Whereas the pneumonia cases can be a bit more bimodal in that they could be really old or really young patients that have it, and it could be any dog type, any breed type. So that may help narrow it down as well for the vet. Also, with cardiac disease, you tend to expect, again, not always, but you tend to expect either high blood pressure or low blood pressure. Whereas in pulmonary cases, the blood pressure probably should be pretty normal. Again, except if they're really badly affected, then there may be some disparity there. But in general, normal blood pressure for pulmonary disease, high or low blood pressure for cardiac. So those are some examples of situations that you can differentiate between whether it's cardiac or pulmonary without having any diagnostics. And then the final thing is the pet's history. Do they have a history of heart disease or heart arrhythmia or not? That may play a role. Do they have infection anywhere else in the body? Because infection anywhere else in the body can spread to the lungs. So they have any history of that. So there are other ways, historic factors that can help to differentiate between pulmonary versus cardiac. But like anything else in medicine, it's very rarely black and white. It's almost always gray. And it takes experience to try and figure it out. At the end of the day, the main goal that your veterinarian will have if your pet's in a crisis is, can we capture the airway? Meaning, can we get air into this patient, oxygen? Can we supplement them with oxygen? And then we have to control for what's most critical, which in most cases is any sort of systemic derangements like low blood pressure, sepsis, things like that. All right, I hope that helps folks out. Thanks for those who attended. We had 3 members today who joined, yay, or 3 folks in the audience. So that's great. And thanks to those who watch in the playback. We'll see you guys tomorrow. Tomorrow should be, what is it? Tomorrow is Sunday, September 22nd. Talk to you guys then. Bye-bye. Bye-bye. Bye-bye.